The following segment is sponsored by Oakview Medical Associates.
When it comes to your family's health and well-being, lifestyle medicine offers solutions that can reverse health issues and even prevent them. Dr. Nita from Oakview Medical Associates is with us. Good morning, Dr. Nita.
Good morning.
As a family physician, you're the only triple board certified MD in South Carolina. What does that mean?
So I, did my residency in family medicine, and I'm board certified by the American Board of Family Medicine. Additionally, I sought training and completed my American Board of Lifestyle Medicine and American Board of Obesity Medicine, which really allows me to look at the complete picture as far as any patient goes. We look at patients may present with some sickness, but then we want to kind of help them evolve to the healthy wellness model. And we see people of all ages, so even lifestyle medicine and weight loss medicine, we really focus on all the age groups.
Your family approach to well-being addresses areas like stress management, quality sleep, healthy eating, activity, and connectivity. So let's start with stress management. And when it comes to that, you say everybody, especially parents, needs to take time for their own daily self-care, right?
Yes, being a parent myself, and it's really challenging trying to manage a full-time profession and family life, but really not being over judgmental, just knowing that you're doing your best, incorporating some simple habits into your routine. Keeping a routine schedule is another important thing. That would help really stabilize the environment in your home as well. So as parents, making sure we keep a cheerful atmosphere in the home, helping our kids stay really occupied with some constructive work. It could be a physical activity outdoors. It could be a little craft item every day. So as parents, we're really responsible for making sure we incorporate the mental health in our family, because mental health actually affects chronic disease more than we know. 1 in 5 Americans actually has mental health or mental illness at some point in their life, and 1 in 5 children do as well. Suicide is actually the second leading cause of death in age groups 15 to 24 years of age. So it's really important that we address this emotional well-being for the whole family.
And another big topic is quality sleep. We're going to do a whole segment about this for next week, but give us a few tips about good sleep.
Sleep, I think, by far is one of the most important things in primary care that really impacts chronic disease and keeping a patient well. Setting a bedtime routine, being as consistent as possible, setting that for yourself and for your kids, that's important. Making sure you don't have or minimizing the distractions around your sleep time routine, taking away electronics at least 30 minutes before bedtime. Those are some of the things. Also, not consuming alcohol or sometimes just not having any heavy food right before bedtime, that will interfere with sleep. That's important.
Okay, and healthy eating seems to be at the root of everything. How can families do it better?
Healthy eating, starts with, I guess, what we shop. So making sure you don't shop for items that are highly processed, filled with sugar, keeping it really, well balanced at home, making sure your family gets at least 5 servings of fruits and vegetables a day is the recommended guideline. That's not even going overboard. That's the normal, what's recommended. And so at Oakview Medical Associates, we really make that very clear to our patients. We give them visuals. We actually go through the whole process sometimes of cooking a meal or making it easy for them to follow. We don't want patients to get overwhelmed with the whole concept. And even if you incorporate a few little things into your routine, that goes a long way. Keeping your hydration. 8 glasses of water a day is what's required for maintenance. That's not overloading yourself with fluid. But talking to your physician is number 1.
And you're also a big advocate of families engaging in exercise together. So how do you encourage the healthy amount of activity?
Yeah, that's challenging. Now, with kids at home during the summer break, it's probably a little easier. You can start with maybe just a family walk in the evening, 30 minutes, just enjoying the hopefully cooler weather in the late evenings. You can play a game of tennis with your kids or just run around the yard. A lot of things that otherwise we didn't have time to do, but now, in a sense, we have more time on our hands and we should be able to mindfully do these activities with our children.
And finally, nobody's health journey happens alone. You say it's very important to stay connected. How do we engage one another?
It's very easy to feel lonely and have a lot of fear during this time, which we're seeing a lot in our patients, easily agitated, angry, easy to come to conclusions. But we want everyone to know we're all in this together. Please maintain a happy attitude, expect the best from others, have empathy, understand other people. And that's really going to help your own health in the long run. It's important to stay connected, make sure you have meaningful conversations with your parents, your children, your siblings. And now with Zoom, you can really stay connected. Schedule that once a week with your family all over the US. Or it's really important to maybe write down a few things you can do and stick to them. That way you feel at the end of the week, oh yeah, I had a good week, I really incorporated some things for my family health and well-being.
Well, we always feel great when we're connected with you, Dr. Nita. Oakview Medical Associates is located at 11 Five Forks Plaza Court in Simpsonville. The number 627-0444, number on your screen. Thanks so much for being here, Dr. Nita.
Thank you. That's why I'm outdoors today. I'm enjoying some of the nice weather.